says Charles Wisonge. Charles, a very good morning to you. Thanks for your time this morning. I'm very curious as to how you actually measure, how can we predict sort of information like this, that South Africans will be able to live at least 7 years longer by the time we reach 2040?
Yeah, thank you for having me here. Well, I must precise that I was not an author on this particular paper. But the colleagues that work on that, what they do is they get information on the risk factors for death, the current information about what people are dying from, at what age they are dying, and all of that is put into a model, and there are calculations based on what we know now and what is being done now, and we can plot a curve that shows how we'll continue into the future. But what also happens is when you do that, it assumes that what is happening now will happen in future. But we could do better in future in terms of providing better health services. So we might improve and even have longer lifespans. But we could even do worse. And the example that I could give is what happened in the 1990s. We were about the same level where we are now in terms of life expectancy in South Africa. And then the HIV epidemic just came and it was like a tsunami. And our life expectancy just went down the drain. Yeah, and we were about 52 years, about 2006. And then a lot of things were done. After the AIDS denialism, then antiretrovirus therapy, prevention of mother-to-child transmission of HIV. And we have been able to improve. So that just creates a scenario that if we do something with what we have now, things can improve. But if we don't do anything, things can actually go bad.
Yeah, because it is quite baffling then when we consider that, you know, we're always talking about how the quality of our food is not the same as it was decades ago, how we're living with so many chemicals in our body. We're living with more stresses as well. So based on those factors alone, you would think that we would actually be dying younger come the year 2040, wouldn't you?
No, because in addition to that, obviously, many things are changing. You know, when with development, our foods, probably a bit more fat and all of that. But we also are learning, we have new technology like vaccines that prevent some of the diseases that used to kill children very early. So children can now live up to a very ripe age. So we also have other things like I talked already about prevention of mother-to-child transmission of HIV. We know we have most of the treatments for a lot of the diseases. So with all of that, you could actually expect that we will live much longer. But then with that development comes what we call diseases of lifestyle, where people now are not as active as they used to be, like you just said. People are consuming more fat than they used to do, consuming less fruits, less vegetables. And then, though there is improvement on one side, then there are also these limitations with development about what we eat and what we don't do in terms of exercise. So when you put all of that together, then you can see where we are now.
So that is why diabetes will be possibly the leading cause of death when it comes to 2040.
That is what the estimates show. And that you can actually, if you look now, if you go just out on the streets there, you can see that your average person is probably a bit more overweight than 20 years ago. So there are various things like we're increasing in, more people are becoming obese, more people they are not physically active. The kind of foods that we eat, we are not making very good life choices. And that goes to maybe what we should do, and we can do something about that, is if we start from the households. If we can teach our children about healthy eating, about the importance of doing exercises, and all of that, you know, when they learn all these good habits, then they will live with them.
All right, Charles. So I see here that the average life expectancy is expected to increase from 62.4 years, and that was, well, where we were in 2016, to 69.3 years, if all goes well, as people behave themselves and do the right things by 2040. Yeah. But I see that Spain might actually be the place that we would want to go and live, because they're first on the list. They're number one on the list in terms of increasing lifespans.
Yeah, that is true. Currently, Japan is first, but it looks like Spain might overtake them.
Yes,
will be. What is Spain doing Yeah, what is Spain doing better? I think there are things like what we just, because most of the diseases that are going to kill us a lot in future are those that are linked to lifestyle. They are probably their food is getting they're eating healthier. They are becoming more physically active, and those other technologies, those other services that they had before, like having very high coverage of vaccination, ensuring that children live long, they don't die young, and all of that. Those services are improving. They are improving their vaccination coverage. They are improving their other health services, and then they are living healthier lives. When you put all of that together, it shows that in 2040 they will be
top of the list. Fantastic. Thanks very much.
If you go to live, if you go to live there, yeah, thank you.
All right, thanks very much. And that's Cochrane SA's Charles Wisongi just shedding some light on that study predicting that we'll be able to live a little longer come 2040. Well.